everyone, welcome back to my YouTube channel, and today we are going to talk about types of endodontic infections. So let's start our topic with introduction. Endodontic infections are infections of dental pulp and periodicular tissue that occur mainly as a result of microbial invasions. These infections are commonly associated with dental caries, trauma, cracks in teeth, or failed dental restorations. Microorganisms gain access to pulp chamber and root canal system, leading to inflammation, tissue necrosis, and periapical pathology. Based on origin, duration, and clinical presentation, endodontic infections are classified into different types. The types include primary endodontic infections, secondary endodontic infection, persistent endodontic infection, acute endodontic infections, chronic endodontic infections, intracanal infections, extraradiccular infections, periapical abscess, and phonic sepsis. Now let's talk about these one by one. First type is primary endodontic infections. Primary endodontic infections occur in teeth with necrotic pulp that have not received any previous endodontic treatment. These infections develop when microorganisms invade the pulp tissue through carious lesion, exposed dentine, and or through traumatic injuries. The microbial flora is primary infection in predominantly polymicrobial and mainly consists of obligate and aerobic bacteria. These microorganisms colonize the root canal system and cause pulp necrosis and periapical inflammation. Primary endodontic infections are commonly associated with conditions such as acute and chronic apical periodontitis and periapical abscess. Second type is secondary endodontic infection. Secondary endodontic infections occur in teeth that have already undergone endodontic treatment but become reinfected due to incomplete cleaning, inadequate obturation, corneal leakage, or errors. In these infections, microorganisms either survive the initial treatment or enter the canal afterwards. Microbial composition is usually less diverse compared to primary infection and may include bacteria that are resistant to intracanal medicaments and antimicrobial procedures. Secondary infection often lead to persistent periapical lesion and treatment failure. Third type is persistent endodontic infection. Persistent endodontic infections are infections that remain in the root canal system even after proper endodontic treatment. These infections are caused by microorganisms that are able to survive harsh conditions such as nutrients deprivation, high pH, and antimicrobial agents. These bacteria often colonize inaccessible areas of the root canal system, such as dentinal tubules, apical ramification, and isthmuses. Persistent infections are commonly associated with chronic apical periodontitis and are a major reason for unsuccessful endodontic therapy. Fourth type is acute endodontic infection. As acute endodontic infections are characterized by rapid onset, severe pain, and active inflammation. These infections often result from sudden microbial invasion of pulp or rapid spread of bacteria from a necrotic pulp into periapical tissue. Clinically, acute infection may present with symptoms such as throbbing pain, tenderness on biting, swelling, and sometimes systemic signs like fever. Conditions such as acute apical abscess fall under this category. Fifth type is chronic endodontic infection. Chronic endodontic infection develops slowly and may remain asymptomatic for long periods. They are usually associated with long-standing pulp necrosis and low-grade microbial activity. Patient may show minimal symptoms, but radiographic examination often reveals periapical delucencies. Chronic apical periodontitis and chronic periapical abscess are common examples of chronic endodontic infections. Sixth type is intracanal infections. Intracanal infections refer to infections confined within the root canal system. These infections are mainly responsible for pulp necrosis and periapical inflammation. Microorganisms in intracanal infection form biofilm on the canal walls and within the dentinal tubules. The presence of biofilm makes this infection difficult to eliminate and contribute to treatment resistance. Seventh type is extraradiccular infection. Extraradiccular infection occur outside the root canal system, mainly in the periapical tissue. These infections may develop as extension to intracanal infections. Some extraradiccular infection can become independent of the root canal infection and persist even after proper root canal treatment. They are often associated with periapical abscess and actinomycotic infection. Eighth type is periapical abscess. That is, a periapical abscess is a localized accumulation of pus in the periapical region caused by spread of microorganisms from infected root canal. It can be acute or chronic. Acute periapical abscess present with severe pain, swelling, and possible systemic symptom, while chronic abscess may present with sinus tract and minimal discomfort. Ninth type is phonic abscess. Phonic abscess is an acute exacerbation of chronic periapical lesion. It occurs when a previously asymptomatic chronic infection suddenly becomes acute due to changes in microbial activity or host resistance. Clinically, it presents with pain, swelling, and tenderness similar to acute infections despite having a chronic origin. Conclusion of this lecture video. Endodontic infections are complex microbial diseases that can be classified into primary, secondary, persistent, acute, chronic, intracanal, and extraradicular infections. The type of infection influences clinical presentation, treatment approach, and prognosis. A thorough understanding of these types is essential for effective diagnosis, treatment planning, and successful endodontic therapy. And this was all about types of endodontic infection. Hopefully you like the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.